Another Plateau station with Dr. Al. So yesterday my grandmother fell and accidentally broke her hip. She has very advanced osteoporosis and it got me wondering, what if you guys had osteoporosis on the day of the exam? Would you be able to manage it? To be fair, it's not unlikely that you'll get it. Osteoporosis is quite a common condition, but I'm not aware if it so happened that it was brought up before in one of the stations. I don't know anything about PLAP2. But for the sake of this video, let's just casually talk about how do you manage osteoporosis in PLAP2. So you go through the history, or if you have already the diagnosis and it's a counseling station. Let's talk what if it was counseling station, because osteoporosis, there's not much going to be a lot of history to ask about. It's I mean, let's say you went through the history, okay, and you got to the investigation management. You have to mention that right now I have to do your fracture risk. If the fracture risk is high, I'm gonna do your DEXA scan, or if the patient already has a fracture, like my nanny, you're just gonna send for a DEXA scan. Okay, you get the result. The patient has osteoporosis. We will start bisphosphonate. You have to know the tablets that a female can take and the tablets that a man can take. Luckily for female, all she can get like daily and weekly from either aldronate or risodronate, whereas for men can only have alendronate daily, I reckon, or risodronate weekly. You might want to check this on the NICE's guidelines, but I think that's correct. Anyway, so we've started this tablet. Now what do we have to do? We have to give a lot of information about the side effect. This is a nasty little tablet. Trust me on this. When you prescribe it to anyone, you go like for 15 minutes explaining the side effect. You have to go to tell it could cause nausea, abdominal pain, muscle pain, osteoporosis, a lot of things. All right? Then here comes the advice. How do you advise the patient on taking this tablet? This is important. So, empty stomach or on food? Empty stomach. Before or after food? Definitely, I just said it, before 30 minutes before food. At least 2 hours after any food if the patient has already eaten. With a big glass of water, upright position, must not lie down for another 30 minutes after taking the tablet. Then there's this very small interesting part on NICE's guideline about what would you tell the patient if the patient forgot a tablet, which is very likely to happen. The patient might say, "Oh doctor, what if I forgot one?" Read this, be able to answer this. If not, watch the next video where I'm going to tell you what you give the patient as an advice and what are the lifestyle modifications that you absolutely have to talk about.